Hi, Simon, one of the doctors here at Preston Family Medical, talking about preventative and long-term longevity and health span promoting care. So this obviously has a bit of a moment at the moment. We've got a lot of social media talk about longevity and lifespan, but I think this is at its core just good general practice. Prevention, of course, is worth far more than cure, and so anything that we can do to preserve health in midlife is going to translate to significant gains in later life. You know, if you want to be a better than ordinary 80-year-old, you've got to be an extraordinary 40-year-old. So we want to be really aware of preventative healthcare, things that we do, we know that will promote health across the lifespan. And we don't just want to live longer, of course, we want an active, healthy life across that lifespan. So this ranges starting right back in childhood with great nutrition, preventative vaccination schedules, following up of growth and development across the childhood years. It's around in the teen years, again, preventative vaccinations, avoiding some of those conditions like meningitis B. Vaccinations now available for that can have a terrible effect, although very rare, in teen years. It can be around pregnancy care and a great healthy pregnancy and delivery across midlife. And then it's around prevention care of the things that we know are the big killers. Cancer, and this is around cancer screening programs, bowel cancer screening, skin cancer screening, breast screen, mammograms, cervical screening program, prostate cancer screening for the blokes, and heart health checks. So definitely blood pressure, cholesterol, consideration of folding in some other things like calcium artery scoring screens and using the Australian heart risk calculators to think about risk and prevention long term. And we also know that diabetes is a big risk here as well. So following up on sugar tests, assessing for any impaired fasting glucose. So is glucose higher than it should be when we haven't had a meal? And we do know, thankfully, that there are things that now can prevent or delay the onset of adult onset diabetes, or if adult onset diabetes has developed, really effective treatments to contain and control this and reduce your risks long term. Dementia, obviously, is a real problem and killer of Australians, unfortunately, as well. And a lot of these things all interlace. So great sugar control, great blood pressure control, all interact with diabetes risk and dementia risk long term. So things that we can be doing here can have a terrific benefit long term. Muscle mass, balance, avoiding falls, these all tie into health span benefits that really do give you that best chance of a quality life in older age. So all the doctors here at Preston are very competent in doing this whole of person life spectrum care. We're very happy to talk to you and see which stage you're at, what are the right things for you to be doing to protect your health over this time and really look after your health span long term.